Good afternoon, everybody. This is Dr. Duncan McCollum coming to you from KSCO Radio in Santa Cruz. Very awesome to be here. Love talking about health and see what we can do to help you make your health better. This is probably the best time in a long time to really focus on your health because the whole country is moving towards taking a look at what is actually causing chronic disease and figuring out what we can do to help it. So, this show is about reversing chronic disease, and we understand that the number one cause, actually, 15 out of 16 of the most common diseases are caused by inflammation. Chronic inflammation causes chronic disease. So it's really important that we understand if we want to become healthier, how do we get chronic inflammation? What can we do about it? So there's a couple steps that we need to look at. First and foremost, we need to realize that disease doesn't happen overnight. Unless you're exposed to something drastic or have an accident or injury that weakens your immune system so much that it's exposed to the environment. It is a gradual progression of toxicity that gets at a cellular level and starts to break down life itself because life is in the cells. You have 75 trillion cells that make up your body. And those cells need to operate and communicate amongst themselves very well in order to move forward with life. It's the breakdown of the communication between the cells that is actually causing the disease. So I'm going to go into that quite a bit. But first and foremost, I think it's important to take a look at how you are functioning today. So a lot of times when people come into the office, their body is not working well. Oftentimes we're the last place that they're going to go. We're like at the end of the rope. They're heading towards the Golden Gate Bridge. And quite honestly, I had that experience myself because I had a severe back injury as a kid, which most of you probably know about. But I'd literally given up on Western medicine. I was trying to take anything I could to medicate the pain or mediate the pain, anything and everything, and it was killing me. And finally, I was carried into a chiropractic office, and the rest is history. But wherever you are on your health journey, it's not too late for a new beginning. And we're here for you. We can help you with that new beginning. And the most important thing is to understand that it starts with you. Your health, your choice is the name of the show today. And I really want to help you understand this. I have patients come in. I had a lady come in last week who was overweight quite a bit. Her knees were pretty messed up, and she was trying to get her body healthy so that she could have her knees replaced. And we took x-rays of her knees, and they're pretty bad shape, but they won't do the surgery until she loses weight, which is really great. Oftentimes I hear people come in and they've had surgery done when their body wasn't ready for it. And it's a big journey to be able to get to a point where Western medicine's intervention can can be helpful for somebody. But the truth is, how did you get there, and where are you going right now with your health? Do we have time to turn it around? I was hanging out with one of my best friends for the last 65 years. We met when we were 4 and 5 years old, and we were hiking up in Big Sur this last weekend. And he's a now retired emergency medical doctor, emergency room doc. For 30 years, he was in practice. He was also in the Air Force, have 17 tours of duty. So this guy's seen it all. And we had talked all the time. We would kind of get into this. I'd tell him about what I'm doing health wise to try to turn back the chronic inflammation that's causing chronic disease. And he would look at it and go, no, that doesn't work because of the medical reasons. And we finally realized that he's seeing people in the emergency room at the end of their rope or for an emergency, but a lot of times it's the failure of a body from chronic disease where I'm hopefully seeing them and you before you get to that point so we can turn it back. So chronic disease at a level that isn't life-threatening, and even at a level that is life-threatening, the cause of it, 15 out of 16 times regarding the most common disease, is inflammation. So we need to learn how to fix chronic inflammation. And there's a few things that we need to do. Number one, we got to take a look at your body where it's at today. And then we need to do some physical corrections on it and then chemical corrections on it. So the physical means if you can't exercise, if you can't walk, if you can't ride a bike, if you can't just move your body around, the chances of your body healing are very slim. So we work with a lot of people with something called peripheral neuropathy. This is a chronic degenerative disease caused by chronic inflammation in the body. And that could be from diabetes, it could be from cancer treatment, radiation, chemotherapy, exposure to different chemicals out in your environment. Right now, we know there's 250 billion tons of chemicals dumped on the environment every year on the planet, and these accumulate in our body. Now, luckily, we have people in power that are looking at getting the toxins out of our foods, getting them out of our local environment. Like even if you buy a new couch or bed of some kind, you got to let the thing off gas because it's got chemicals in it like formaldehyde and all these things that a little bit at a time are going to get your body toxic and poisonous, and it accumulates in the body. So I'm going to kind of try to get this so you understand the toxic inflammatory side and the physical inflammatory side. So if we can get those two, then we can start to improve them and improve your health. Of course, there is also the mental inflammatory side, which is what we think about. They call it stinking thinking. And that's why we talk about gratitude. And we have gratitude bottles here that you can come and pick up. 100% gratitude help turn around a lot of the chemical stuff going on in your brain, because your brain, when it's inflamed, all kinds of disease occurs. So if we're going to talk about physical for a minute. So when we have in our coming out of our brain, the nervous system goes down the center of the body, the center of the spine, exits 31 times, and goes to 75 trillion cells. Now, if you have problems with any of your physical components, your limbs, walking, your feet, peripheral neuropathy, we got to look at where where you're being exposed. So when we look at right up at the very top of right below your ears, if you feel your neck right there, the very top bone or vertebra is called C1 or the atlas, and right below it's the axis. This is some of the most important nerves in your body because it controls almost everything. Coming right out there is something called the vagus nerve. The vagus nerve is the longest nerve in your body, and it winds around. It's the wandering nerve. It winds all throughout your body and controls all of the organs. So it's like it controls the rest and digest organs, helps make sure your heart's beating when you don't have to think about it, your lungs working when you don't have to think about it. And all of this stuff, when you have pressure on the nerves up here, you can not sleep well, you can have digestive problems, heartburn, constipation, asthmas, allergies, hormonal issues because of the pressure on the nerve up here affecting the communication from the brain and the hormones up here, the hypothalamus and pituitary, that comes out and affects that vagus nerve. So we want to make sure that's clear. Also, the top is very responsible for headaches, for tightness up in the neck, and even down into your hands. It can affect your moods, your sleep. It can affect your attention, your sinuses, and of course, all of your immune response. As we move down in your neck, we get to the thyroid gland. If you just think about wherever those organs are, if you run your hands from your throat down, you have the lungs, the heart, you get down to the diaphragm, and below that you have the pancreas, which is so responsible for diabetes. Your stomach is there, your small intestine, your large intestine, gallbladder. All these organs are controlled by that vagus nerve. So if you're having some issues with any digestive disorders, you've got inflammation in that area, your body's not going to function well. So the large intestine is one of the main causes or results of chronic inflammation. And this is because of our poor diet over the years, the toxins on the food, the glyphosate, the forever chemicals, the additives that have been allowed in our food over the years. And this causes inflammation in our gut, and it can be very slow to manifest and insidious in onset of disease. But because this gut, the digestive system in the large intestine starts to break open, the cells in your large intestine start to divide apart. You get large components that should stay in your intestines and go out your body, getting into the bloodstream of your body. They're called LPSs, or lipopolysaccharides. And these things are very, very inflammatory and very dangerous because they will break down your body. They'll cause inflammation throughout the body, and especially on the brain. We know that 50% of the people over 50 years old now are going to get Alzheimer's disease the way things are going. Now, Alzheimer's disease is an inflammatory condition. It's also called diabetes type 3, which is also called hyperinsulinemia. So what does that all mean? Well, hyper means too much. Insulin means insulin. Emia means blood. So hyperinsulinemia, diabetes type 3, and Alzheimer's disease are all synonymous. So how come you have too much insulin in your blood? Well, if you're diabetic or pre-diabetic, and the solution that you're giving is more insulin, you're not solving the problem. It's kind of like trying to wash the dishes in your sink and the sink's plugged, and you just keep putting more dirty dishes in there. It's going to spread out and flop all over the floor, and then you're going to have a disaster. Well, that's what's going on in the body at a cellular level. The cells have inflammation in it because of things like the leaky gut I was mentioning, where you get the lipopolysaccharides coming out of the intestinal wall into the bloodstream and into every cell and organ in the body, and especially the brain. Once the brain starts to not function well, it's going to be history unless you do something about it. Now, the good news is we can help you with this, but the first thing we need to do is make sure, here's the way I like to explain it. If you're in a boat and you're rowing down the road, and all of a sudden you notice a boat sinking, and it's sinking relatively fast, you have two choices: bail the boat out or try to plug the hole. There's no land in sight, so you can't jump out of the boat and swim to shore. Two choices: bail the boat out or fix the hole. If the boat's sinking quickly and you try to fix the hole, the chances are the boat will sink before you get the hole plugged. So the first thing you need to do is bail the boat out. And in the body sensation or understanding, we need to fix the symptoms that are affecting your body from functioning well first. For instance, if you have peripheral neuropathy, we've got to turn around the destruction of the nerves in your extremities. If you've got digestive disorder, inflammation of the gut, then we've got to reduce the inflammation in the gut to stop the leaky gut, to stop the chemicals from destroying the organs and cells in your brain, okay? So when somebody comes into our office, we do a thorough evaluation. we want to make sure that the physical body is working well because of those 31 spinal nerves going to every cell and organ in the body. If one of those nerves has pressure on it and or is pinched, if you'd like to say, I don't care how many supplements you take or massages you get until you open up the communication line, that organ is not going to get the right information. It's like a dulled light bulb. It's like the light goes out or it's barely blinking. You're not going to get the organ working well. So you have to turn on the power. You can't keep changing the light bulb without making sure the light is plugged into the power source, or keep changing a light bulb without resetting the circuit breaker in the wall. So the spine is a circuit breaker. You get down right at the base of the neck, and those nerves go into your shoulders and your hands, your thyroid, your lungs, and your heart. If you have neck pain, it's a warning sign that you've got something bigger going on. A pain that lasts more than a couple days is a sign of a chronic inflammation or chronic pressure on the nerve coming out of the spine, going to different parts of the body. So a lot of times people have numbness or tingling in their hands. It might be just at night at first. It might be very slow in coming on, but if it's coming on, it's telling you there's a chronic problem that needs to be addressed. So we do peripheral neuropathy tests here in the office, and we do a complete evaluation of your extremities. We do full X-ray of the body of the skeleton to make sure that it's not just a simple pinched nerve. If it's a simple pinched nerve, that's easy to fix. If it's destruction or wasting away of the nerves coming out of the spine, going down to your feet and hands, it's a bigger issue. But if we catch it in time, we can help it. We've been turning around a lot of peripheral neuropathy for people. We have an evaluation at our office. We're doing a talk on the 18th, a lunch talk at our office on peripheral neuropathy. This is Dr. Duncan McCollum. You can call 831-459-9990 and get a seat at the table for our peripheral neuropathy talk on the 18th of March. It's going to be about 12 o'clock. And the seats fill fast because this is such a pandemic in our society is people with peripheral neuropathy affecting their ability to function and get around. So if you can't get around, then that's the biggest issue. You've got to bail the boat out. We've got to fix the nerves first, then go plug the hole, which is going to be the chronic inflammation that has been destroying your body from the inside out. It destroys your brain from the inside out. The way that your brain gets involved in this is the same thing. The same stuff that causes the intestinal wall to open up and allow big particles like lipopolysaccharides into your brain, I mean, into your bloodstream. It's the same mechanism in the blood-brain barrier that causes the cells of the blood vessels in the blood-brain barrier to open up to allow those toxins into the brain. So you get hyperinsulinemia on the brain, which means too much insulin in the brain, laying down amyloid plaque and destroying the communication system between all the synapses in there. So this is such a pandemic that we know that 50% of the people over 50 years old will develop Alzheimer's disease or some kind of dementia. So it's kind of like you're just going down the road and you know this is happening and you know not doing anything about it, but something can be done about it. I like to use the visionary analysis of seeing a bunch of cattle heading towards a chute. They're being driven from a very wide path to a very narrow path where eventually only one cow at a time can go down the chute. And at the end, there's a cowboy standing on the top of the two posts. And as that bull or cow goes through there, boom, hit it on the back of the head into the truck, heading off to the butcher. This is the path we're going down. 50% of us are going to develop Alzheimer's disease, going down this path, being pushed away or pushed forward by a blind understanding of health. And then all of a sudden, one cow sticks his head up and looks around and he goes, "Oh my God," he sees what's happening. And he starts going, "Moo, moo, move, move, go this way, go that way, stop." The rest of the cows look over at him and chew their cud and go, "Moo." And they just keep moving along towards that chute. So this does not have to happen. There are so many ways to handle this. Actually, let me take that back. There are some ways to meddle in it and then ways to handle this. So there are some very scientific means to getting the inflammation out of your body on a very systematic path. Now, it's not a quick fix. It's taken a lifetime to get this where it's at. So anybody thinks that you're going to get a 11-day cleanse off a shelf, and this is going to handle your deep-seated chronic inflammation to make sure that your brain doesn't get damaged, then, I got a piece of land to sell you in Louisiana. So if you want to take this seriously, then I might be able to help you. We just have to find out where you're at and whether this is something you want to do. Dr. Duncan McCollum here, 831-459-9990. McCollum Family Chiropractic in Capitola. I've been in practice for 35 years. I've seen a lot of different health issues. I know where we can help and what we can't help and when we need to refer you out. But hopefully we can help bring your body up to a point where Western medicine will be helpful for you. But if you go in already very inflamed and sick and you're waiting to go into the emergency room, like my good friend Dr. Bill would see people at, and you wait that long, it's very difficult to turn around. I see people that come in and they've had the warning signs for so long and they have just not paid attention to it. And sometimes the path up is very, very hard and very difficult. It's always better to catch it early. And, when I broke my back when I was a kid, I got to tell you, as soon as I was out of pain, I was off doing something else till I hurt my back and re-injured it. And it took me a long time to realize that the only way out for me was to fix the problem as best as it could be fixed and then maintain it. You can't just keep putting band-aids on things and expect them to help you. So when we're looking at the two different things I'm talking about here, the chiropractic portion, and by the way, we offer consultations here, no charge, to come into our office, McCollum Chiropractic, 831-459-9990. But we do have the stem cell machine, which I'm sure you've heard about, the Softwave Therapy machine. This has been around. I've had it since 2019. There were only 200 in the country when I got mine. And it made such a huge effect on my injured body that I decided to get one. And this is a machine is being used by places like Harvard, Georgetown University, UC San Diego, Cleveland Clinic, many of the NBA, the um, National Baseball League, and the NFL use this. They have it for their players because it's so effective. So we offer a $49 special to come in and see if the tissue regenerative therapy machine, this Softwave Therapy, can help you. Because if you can't get around and get your body mobilized, it's going to be very difficult to increase your metabolism to a point where it can fix this chronic inflammation. So you got to take a look at the body as a whole. And this is something that I can help you do. So, anyway, if you're interested in coming in and getting the tissue regenerative therapy, it might be for an ankle, a knee, a hip, a shoulder, anything that's stopping you from functioning and impeding your ability to move is going to drastically affect the function of the organs in your body because it's your metabolism has to be raised and lowered. You have to exercise the organs in your body just like you would exercise a muscle. They can't just lie dormant on a couch and expect them to handle the vagaries of life. You know, in life, we're exposed to pretty toxic things on a daily basis, whether it's viruses, bacteria on our food or in our food, chemicals on our food or in our food, in the environment, the air we breathe. And your body's got to be able to flex itself. You've got to have the ability for your organs and your not just your muscles to flex, but the organs to get challenged on a regular basis. Diamonds are made out of pressure over time, and your body functions well when it can go through different or various types of stress. This is one reason we recommend diet variation with your body when we're talking about increasing your metabolism and helping your body handle the environment better. We want to make sure your body's going through, you need to be feeding it different types of food and um, go into, really the seasonal foods are the best way to go. So you vary your diet to challenge the body and to challenge the microbiome in your gut. Those are the bugs in your gut. You have 100 trillion bugs in your gut that are actually digesting anything that you eat and making it available for you. If you didn't have any microbiome in your gut, any food you'd eat would be poisonous to you because you can't absorb it without the help of your friends, the microbiome, the 100 trillion microbiome in your gut. They break down the food particles into absorbable nutrients for you that get through that intestinal wall, which isn't leaking and doesn't have gaping holes in it so that bad bacteria get in there and make you sick. But a nice, healthy intestinal wall will only let the good nutrients in, keeping the bad ones out. Amino acids, fatty acids, vitamins, minerals, various proteins, and um, neurotransmitters are created out of those food things that you eat and get into your body so that your body can sustain life. Those 75 trillion cells, think about it. That's crazy. 75 trillion cells of human cells came from one cell. And when an egg and sperm got together, and that one stem cell blossomed into you. It's a beautiful you. And I'm not talking about a female sheep, I'm talking about you. So it's very important that we start to understand. Now, we have bad habits, so many bad habits. We want to reach for this food or that food, or, we don't want to exercise, or we sit the wrong way. Our posture is terrible. So none of us are going to be perfect, but as long as we move a little bit towards better health every day, with the exception of the days we screw up, we're going to move in the right direction. Our bodies are going to get healthier. So, if you are interested in trying to improve your health, give us a call. Come on in. We have the $49 special, the stem cell treatment. When the cool thing about this is you get to come in, meet our office staff who are amazing. I'll sit down with you and talk about whatever issues you have going on, and we'll decide whether the stem cell treatment is right for you. If it isn't, I'm going to tell you, I don't think I can help you, no charge, to sit down and talk with me. But if we find out that there's something that it looks like the stem cell treatment, the Softwave Therapy will fix, then we're going to go ahead and I'm going to tell you, no, I think this is the right thing for you. Let's get you in and do a Softwave Therapy treatment on you. And after that, we'll meet again and find out whether or not we think it's the right to do more. These are some of the hospitals that use it, some of the teaching institutions, whether you can see this on, might be backwards the way I'm trying to present it for you on Facebook and on YouTube. But this is Dr. Duncan McCollum, KSCO Radio. And I also put all of my stuff up on YouTube, Dr. Duncan McCollum. You can view this with me visibly. You can find all of this stuff on McCollum Wellness Radio podcasts. I have over 200 podcasts on McCollum Wellness Radio, and you can listen to health tips on what you can do to get yourself healthy naturally. So, I'm kind of going back and forth between the inflammatory condition that is causing 15 out of 16 of the most common chronic diseases that kill us. And number 15 out of 16. Well, what's the 16th in the number 16 in that cause of death? It's accidents or injury. So, oh, well, maybe you don't have chronic inflammation when you have an accident or injury. So maybe that's why it's not included in the 15 out of 16. But I want to just give you the argument. If you've got inflammation in your body and your brain, your balance isn't doing well, maybe you have some brain fog, then you get into an accident or you have an injury, you fall off a ladder because your balance isn't right, then I'd say 16 out of 16 of the causes for chronic disease leading to death are related to chronic inflammation. So if you want to improve your health, the number one thing that is common to all of these is chronic inflammation. And you need to understand what chronic inflammation is and where it comes from. Primarily, it comes from a leaky gut. And over a long period of time, these substances get into the cell walls and stop the cell walls from working. This is the big deal. So you're not going to fix the cell walls with a 11-day detox. It's going to take years, not months, to get you there. But when you start, the predominant first, I'd say 6 months are the most important because you have to, number one, it might take a month or two just to handle what we call the downstream detox pathways, just to fix your large intestine. The liver is the biggest or most important detox organ in your body. It's right below your rib cage there. It is responsible for detoxing your blood and making sure that all of those bad toxins get out, either water soluble through your kidney or oil soluble and such through the large intestine and out of your body. So often that liver is been poisoned. Well, over a lifetime, it's poisoned, and it stops working just like a vacuum filter is plugged and you keep trying to vacuum with a plugged filter, the vacuum's going to blow up on you. You keep trying to live with a plugged liver, your body's going to blow up on you. Something's going to cause that. When your liver can't successfully detox the blood, it's going to have dirty blood flowing around in your to all those 75 trillion cells, including the brain. It's going to get through that leaky blood-brain barrier and cause inflammation on the brain. That's why 50% of us are going to have Alzheimer's disease because of this leaky brain that is not being addressed. All that's being addressed is the symptoms that show up when they become bad enough, then you have to go do something about it. So my challenge to you is not wait. If you're interested in finding out about what you can do for all of the inflammation in your body, then call our office, 831-459-9990. We just finished a 30-day challenge that you can do. It's online and it will help you start to eat the right foods. It will give you recipes. It will show you what to stay away from and what kind of foods to eat. And you have to just realize that you have to abstain from those things that have caused your body to be inflamed. Forever? No, but until you get your body right. So, people say, do I have to eat like this forever? Well, no, let's just get you down to your fighting weight. Let's get you down to we can get the inflammation out of the body. Life is to be enjoyed. One of our problems is we just enjoyed it too much for too long. We've been eating what we want, when we want, as much as we want, with whoever we want, wherever we want, for way too long. Ever since World War II, we've been able to get any foods we want all year round. And a lot of them are very toxic, coming from other countries with no regulation. Even though it might say organic on it, you have no idea where that food came from and what's in it. So we have to go through a systematic improvement of the organs of your body and help get the inflammation out of the body at a cellular level. And this is a dietary change that is important, and you have to become aware of where the toxins are that are actually been poisoning your body and eliminate them or reduce them as much as possible. It's not just the food you eat, it's the chemicals you're putting on your body. People still use deodorant with aluminum in it. We have aluminum falling out of the sky every day because they use it in airplane fuel now, because you get better gas mileage with aluminum in the fuel. They're also putting other heavy metals in there. There's also a lot of other stuff falling out of the sky. When we do heavy metal tests here, we're seeing really high cadmium levels, mercury, aluminum, silver, bismuth, lead. All these things get into the brain and they just dull the cognitive functions of the brain, as well as they allow anytime you have heavy metals in the body, it sets the stage for a big party of bacteria and molds and viruses to hang out. They all hang out together and they just reap havoc on your body. So getting rid of this stuff is very important. And you need to do it in a very, very careful, systematic way, or you can cause yourself a lot of problems. So many people, especially when the ketogenic diet came out a few years ago, before the big debacle that we had, people just jumped on the bandwagon. They're still doing it wrong. They are doing one meal a day for day after day after day, and they don't realize they're starving their body. They're wasting their muscle and their brain, because when you don't have enough fuel, your body is going to start to burn excess fat, which is kind of what we want. But if you don't know how to do the ketogenic diet well, and you're not doing feast and famine cycles, you will waste your muscle away after a while, and you will start to waste the brain away. So you wouldn't take your Porsche apart and try to put it back together again. I guarantee the human body's a lot more complicated than that Porsche. And you can get away with so much and think that you're doing well until you're not doing well anymore. So, I wouldn't risk it, knowing what I know and working with the people I know. I was at a seminar a couple weeks ago with a bunch of functional neurologists. Now, there's only 600 in the country that are functional neurologists trained on how to reverse chronic inflammation in the body and, of course, in the brain, because chronic inflammation in the brain short circuits the functions of life. And once you start getting brain fog, that means that there's inflammation on your brain. And if you don't shut it off, it's going to continue. And I really don't recommend that you wait until it's so bad that it's going to be very difficult to turn around. The sooner we handle it, the better. But you can't just go for the brain. The reason you have brain fog is because the body's overwhelmed with toxins. The reason your body's overwhelmed with toxins is because your digestive system can't get them out of your body quick enough. So you have to start by improving the digestive function, handling the leaky gut. Once that's in pretty good shape, we can start to detoxify the body, the organs below the neck. Once we get that cleaned out a bit, we can finally go towards the brain. It's called a concentration gradient. If we try to undo the brain too quickly, we're just going to reap havoc and get more toxins in the blood-brain barrier, and we're going to make the body worse. It's redistribution of the toxins that are stored throughout the body. Certain organs, like the liver and kidneys, hold on to mercury more than other parts of the body, but soft tissue is loaded with these toxins as well. So we want to make sure that we are getting rid of those. So on the 18th of March in my office here, we're doing a peripheral neuropathy workshop about 12, I think it's, 12:15. And we'd love you to come meet our office, ask questions, find out what we can do to help you. And, if you want to do that, please call 831-459-9990. Let's see what we can do to help you achieve better health. And if you just have physical conditions going on, knees, elbows, you can't play pickleball anymore. You can't run around on the court. You can't even get up and go garden. You can't walk on the beach. All these different types of things. you've lived and worked too long to go out this way. So, the golden years have become the imprisoned years for so many people. They've worked so hard, put away money, only to go, we can't go to Europe and walk on cobblestone streets. Why? Because your body's breaking down. There's, there is a solution to this, and I really hope that you take advantage of it. The organs below your rib cage, down to your belly button and below, are all the vitals. These are the above the in the rib cage is the vitals, which are your heart and lungs. The vitals are below the rib cage. You have your pancreas, which produces insulin and digestive enzymes. You have your small intestines that come out of the stomach. You have the stomach, large intestine, and then out of the body. Obviously, that's where we eliminate. We have the um, gallbladder, which is connected to your liver. So many people have had their gallbladder out, which is, you know, a solution to having, excuse me, a solution to having too many toxins in the body for too long. The gallbladder gets stodgy and just needs to be revitalized, but they often just pull it out and not as an emergency and don't tell you that you are going to have to change your diet for the rest of your life. And especially when a lot of times it can be saved. But the problem again is you waited too long. You had to go visit my friend Bill in the emergency room because your gallbladder got so plugged up that you started in having incredible pain, right arm pain. You think you're having a heart attack, and you go in and it's a gallbladder attack because gallbladder attacks can have similar symptoms to a heart attack. They come in and go, "Oh, don't worry, it's not a heart attack. It's just your gallbladder. We'll pull it out." And you go, "Thank God, get it out of me." But you waited too long. It's not the best way to stay healthy. You're much better off if you can start to take care of this early. Clean your body up now. That's what we specialize here in my office. And we do, you see a lot of the supplements behind me if you're watching this on YouTube. And you can watch all my shows on YouTube, Dr. Duncan McCollum. I've got probably over 300 or 400 videos up there of my radio shows talking about various things. You can also go to McCollum Wellness Radio podcast when you're driving around, listen to them. Um, this is this is the right time to do something about your health. The whole world is looking at the health conditions. We're rated 50th in the world for health because we have more additives in our food than any other country. Most countries won't even accept the food that we are feeding our kids or buying on the shelf with all the additives. But don't worry, we're doing something about it, right? Red dye number 3 has been banned from the United States. We've known that it's caused cancer for over 20 years, and they're finally banning it. Woohoo! But it doesn't go into effect till January 15, 2027. So if we know it's cancer causing, and if we know it's in our foods, why do we have to wait till January 15th, 2027 to get it out of the food? And how many other toxins do we know? Canada won't even take our food. Europe won't take our food. We're eating poisons every day. And you wonder why we're the sickest country in the world. If you have two crops of some kind of plant, one crop you put a lot of toxins and poisons on every day. The other one, you just give natural fertilizers and water, which is going to stay healthier longer. The one that you're not poisoning. So you wonder why we spend $4.7 trillion on healthcare last year. 1.7. It was only $1.3 trillion a year before. That's huge. I can't even do the math on that to figure out how much we're spending per person, but it's a lot. And 70% of that has been earmarked to covering up symptoms or managing disease. So the healthcare industry in our country is set up to manage disease. It's not set up to handle health and make us the healthiest country in the world. Does it make sense to you that we are the most advanced or country in the world? We have the best of everything, but we can't figure out how to stay healthy? It just makes no sense. Of course, we can figure out how to be healthy. We just don't pay attention, or there's a lot of investment in keeping us sick. So you can only go along so far as one of those cattle before you either drop or you change direction. So chronic inflammation has to be eliminated or reduced in your body if you want to be and stay healthy. That takes work, but you need a scientific based understanding of how the cells are toxic, why the cell wall is inflamed, and what we need to do to turn the inflammation around. And that we can help you with. If you are interested, you can go to McCollumWellness.com. We have different programs that you can do online, information just to take a look at. We do a heavy metal test here in the office. It's called an scan. It's photocytometry, where we take a picture of your palm of your hand in 4 different spots, and it will read out the toxin level in your cells, the vitamins in your cells, the minerals in your cells. So we can figure out are your cells even able to absorb the nutrients needed to keep you healthy? When you have toxins in your body, meaning your liver's too polluted and too plugged up to actually clean the blood, you get bad particles floating up against those 75 trillion cells. And just if I had a cut in my arm and I kept rubbing dirt in it, it would be inflamed. Well, those cell receptors are inflamed due to the toxins in our body accumulated over time. You can't get the nutrients into the cell because there's too much inflammation on the cell wall. Just like if I had an infected cut on my arm, if I was trying to get something healthy on there, like I'd put hydrogen peroxide on the inflamed cut, it's only going to get to the surface. It's going to take a long time before that hydrogen peroxide is able to absorb into the injury down to the actual human skin, not the toxified, putrid, dying skin that is being affected by the toxins that are basically killing it. So we have toxins killing us in our body. The thing is, our body has this incredible desire to survive, and that desire to survive is stronger than the toxins trying to kill us until it's not, until the toxins take over. So it's kind of like you're drowning in 3 feet of water and you don't know to stand up. Our society, we're rated 50th in the world for health. We take 50% of all the drugs in the world. We're drowning in 3 feet of water. It's time to stand up. You can do something about your health. You can call McCollum Chiropractic, 831-459-9990, and see if we can help you if it's not too late. I hope it's not too late. I have some people come in here and it's too late, and I never want to tell somebody that. There's always some hope. There's always something. But you got to not wait till you're going to the emergency room to visit my friend Bill. He's retired now, so you got somebody else there. Let's handle this up front. Let's chip away at the problems. Let's get your body working as well as it can. And that needs to come from a couple things. The nervous system is prime. That without a nerve, your body won't function at all. Oftentimes people say, well, I have muscle memory. Well, if you take a muscle and you put it in a petri dish and there's no nerve, there is no memory. The memory's not in the muscle, it's in the nerve, in the brain, and the nervous system. So you have to have your nervous system working well. You have to make sure that the 31 spinal nerves are communicating to the 75 trillion cells and organs to bring harmony and coordination of the functions of the body. That has to happen. Then you have to make sure that the organs and cells in your body aren't polluted, because it will be a cesspool of of disease in your body. That's basically what happens when you get organs or cells that are so toxic. It's basically like a cesspool. It will cause a spread of disease that will kill you. When your body's overwhelmed with this, it can no longer survive. So, what do you want to do? Do you want to wait until you need medical intervention? Are you going to help your body first by doing, I'll tell you what, we are very, very, this country and the world, we have so much knowledge of how the body works. You just have to look in the right cabinet. You have to go to the right place to find out what results you want. You can't do the same thing and expect different results. So if you want something that's going to move you towards better health, you really need to explore your options. There is no quick fix. There is no magic bullet anymore. And in order to get healthy, you're going to have to work at it. And you've got to invest in it because insurance isn't going to cover it. I hate to tell you, they're going to cover the dis-ease part, but they aren't going to get you from your I feel better, no symptoms to optimum health. You need to just decide that's what you want. That's how you want to live your life. You want to enjoy it to the end. And we don't get the opportunity to just die of old age anymore. We die of chronic disease. And that's your choice. Your body, your choice is the name of the show. You can do something about it. You can decide to change your health, but it's up to you. It's not up to your medical doctor. It's up to you. At the end of the day, you're the only one that can help you. And until you make that decision to help you, you're putting your hands in, you're putting your life in the hands of people that are looking for, they get paid. So a lot of people get paid to keep you sick. Other people get paid to get you healthy. That's our goal here. And just don't believe me, just look at the statistics out there. And if this resonates with you, then you should call our office. Come in so we can physically get you working. Do this $49 special, the Softwave Therapy special, 831-459-9990. Call today. We can get you in this week or next week. If you want to do the more interested in getting the toxins handled, go to McCollumWellness.com and explore around there. There's lots you can do, but you can fill out the neurotoxic questionnaire that's on there and send it in, and we can set up a time to talk to you about it, see if we can help you. But there are so many things we can do. If you have peripheral neuropathy, come to the workshop Wednesday or Tuesday, the 18th of March. Call the office, 831-459-9990. We have a passionate office, incredible staff, three doctors here. Our goal is to help you. Three chiropractors that are here to help you get your life back. So it's up to you. I really would love to see you. This is spring. It's a perfect time to clean your house, so it's a perfect time to clean up your body. We're doing different workshops to help you, different things that can help you improve your health. But don't wait till you're going into the emergency room. It's just not worth it. Pay attention to your warning signs and do something about it before it's too late. And realize that, again, if it's to be, it's up to me is the motto. Nobody's going to take care of your health better than you, but you need to get educated and understand how to do it. This is Dr. Duncan McCollum, McCollum Family Chiropractic, and I hope that if you can find all of these on Dr. Duncan McCollum YouTube or on my McCollum Wellness Radio podcast. You can send them to people you know. Send them to McCollum Wellness Radio podcast or to Dr. Duncan McCollum Facebook, or excuse me, Dr. Duncan McCollum YouTube, and call our office. Come in and get the exam, get the Softwave Therapy, 831-459-9990, 831-459-9990. Come and see us. Call for the Tuesday, the 18th lunch workshop on peripheral neuropathy. There is no day like today, better day than today to change your health and change your life. Thank you.